vaccination policy position announced by the President of the Republic of Zimbabwe, His Excellency Comrade Emerson Dambudzo Mnangagwa, and Zimbabwe will soon be rolling out a COVID-19 vaccination program under the National Response Strategy to the COVID-19 pandemic. Vaccines are an essential component for COVID-19 control, in addition to all the measures that the country has been implementing. To date, the COVID-19 pandemic has affected the country significantly, resulting in a total of 34,949 confirmed positive cases and 1,382 deaths. The government of Zimbabwe is now introducing COVID-19 vaccination in order to reduce the mortality and morbidity due to COVID-19 disease. In line with this objective, the country intends to vaccinate all eligible populations on a voluntary basis, free of charge, as we have already alluded to in previous announcements. The vaccination program begins next week after the country takes delivery of the first batch of COVID-19 vaccines from the People's Republic of China, where the government of Zimbabwe has purchased 600,000 on top of the 200,000 Sinopharm vaccine doses which were donated to us by the government of China. The Sinopharm vaccine, which has proved to be safe in clinical trials and has efficacy rates ranging from 76% to 86%, and has already been used by other countries in controlling COVID-19. I also wish to inform you that the government is in advanced negotiations to acquire the Sputnik Victory vaccine from Russia, which is also effective against COVID-19. In addition, the country is also pursuing global and regional facilities to secure more vaccines to cover all eligible people. The vaccination program in Zimbabwe will be conducted in a phased manner as follows. Targeted groups for vaccination. The first phase, population at high risk. That's stage 1. Will target frontline workers at significantly high risk of COVID-19. These include health workers, ports of entry personnel, ZIMRA, immigration, customs, funeral parlors, security personnel, village health workers. Stage 2, those with chronic illnesses, the elderly from 60 years and above, inmates and prison population, and others in confined settlements, including refugee camps. Then the second phase will cater for lecturers, school lecturers, all school staff population, and other staff at medium risk, depending with epidemiological picture of the disease. The third phase will target those at relatively low risk until everyone is covered. Progress in preparing for the rollout of the COVID-19 vaccination in Zimbabwe. We are going to definitely need the vaccine and the logistics. The first batch of the vaccine is expected to arrive in the country on the 15th of February 2021 from China, and the vaccines will immediately be distributed to all provinces and districts across the country. May I assure you that we have adequate cold chain equipment to maintain the vaccines in their potent state up to the point of use. The role of the supply chain is to ensure effective vaccine storage, handling, and stock management, rigorous temperature control in the cold chain, and maintenance of adequate logistics management information system. The distribution of COVID-19 vaccines in Zimbabwe will be as follows. On arrival from the airport on the 15th of 2021, it will go to the central vaccine stores, where it will be distributed to provincial vaccine stores, district vaccine stores, clinic vaccine stores. Vaccination distribution flows from the central vaccine stores to the 10 provincial vaccine stores and 63 district vaccine stores, and then to the more than 1,800 service delivery facilities such as clinics and rural health centers. The distribution of COVID-19 will follow the existing distribution structure of routine vaccines and supplies. Vaccination. When you get to the vaccination desk, there will be a desk where there's demographic data collection, your name, so you need to bring your identity card or passport. Then on the second desk, there will be a blood test to make sure, and a swab to look for the presence of the virus when you get injected, or antibodies in your blood system, so that we can follow the potency and the response to the vaccine. And then on the third desk, that's where you get your jab and you go home. And we should remember that this vaccine in particular will have a first vaccine session, and then there will be a second jab after a prescribed days. The ministry is already training people, all health workers who will be involved in the vaccination program, and training will be completed soon in time for the planned rollout. Remember, we have been vaccinating people, polio, TB, whatever else, so it will not be very difficult to teach our health personnel. So the vaccination service delivery will be in two methods. Fixed facilities, like I said, hospitals, clinics, and there will be mobile outreach points. Actual administration of the vaccine will be done by trained staff at fixed and outreach points that will be at public hospitals, public clinics, rural health centers, army hospitals and clinics, Zimbabwe Prisons and Correctional Services clinics, Zimbabwe Republic Police clinics, private hospitals and clinics. And we must remember that these things are going to be done professionally and by professionals. Definitely we will be alert for adverse events following immunization. Policies, guidelines, and systems for the management of adverse events following immunization are already in place, and our health workers will be on high alert to identify, report, and manage any if they occur. Sensitization of frontline workers has already begun for them to take up the vaccine to protect themselves. May I conclude by encouraging all eligible people in the country to take up the vaccine when their turn comes. I also want our people to note that even when they get the vaccine, they will need to practice all the other recommended COVID-19 prevention behaviors, like the proper wearing of face masks, regular washing and sanitization of hands, maintaining social distancing, that's physical distancing, and avoiding gatherings, as we have always emphasized. The ministry will give regular updates to the public and to the media on progress of the COVID-19 vaccine rollout, plus any other developments in the response against COVID-19 in Zimbabwe. I thank you.
Thank you.
Bwana, nataka kuvutumuka live.